Hi, welcome to the show. Today our show is on a subject that I think all of us think about daily. I know I do. And I've convened a panel here today to talk about homelessness. I have three of the people that work constantly in our community to ameliorate this problem. Solve is a big word, but let me introduce Jeff Sargent. Thank you for being here, Jeff. Jeff's the Executive Director of YCAP. Elise Hui, Executive Director of the Housing Authority of Yamhill County. Correct. Thank you for being here. Mm-hmm. And Howie Harkema, a long list of introduction there. Howie, the President of the Compass Center, the organizer of Sea-Wish, and of course you know him from the host of Speaking Frankly, How We Doing? All right. Well, thanks for being here. As we chatted here together to begin with, I kind of noticed that there's a lot of pieces to this puzzle, and that I was seeing that they really were fitting together, and not perfectly like a jigsaw puzzle, but they were creating a picture of how we are addressing this issue in the community. So let's maybe just start talking about those pieces. I'll just go to the top of the list here. We did a homeless count. Was that last week? And I guess I'll go to you, Jeff. YCAP mostly saw to that.
Yes, YCAP's taken the lead on the homeless count for the past 8 years. And it's a national effort on the same day every year in January and statewide as well. So we had volunteers throughout the community and our staff.
How many volunteers?
Oh gosh, I want to say close to 50.
Big increase over last year, maybe 25 last year.
I don't remember the exact count from last year, but we added several new drop-in centers for homeless to come in and get some services, as well as be counted in the county, and put more street teams out to search for folks who are homeless. Yeah.
So I think this is a good place to start, because we're quantifying the problem. Quantifying is maybe one word, and then qualifying, because when you approach someone and ask if you can talk to them about their housing situation, there's a form that if you can have that person give you that information. Can you tell us about that, Elise? You did some homeless work on the homeless count, didn't you?
Yeah, so I was over at the Veteran Stand Down, as was Jeff, in the morning, and so we were counting homeless veterans when they came into the stand down to get other services. And of course, the Veteran Stand Down is not homeless veteran specific. It's for any veterans that needs to connect with services. And so they come in and we'd ask them, what is your housing situation? It's usually the way that I started is, do you mind telling me about your housing situation, to figure out if they qualify to answer the form or not. And then in the afternoon, I was at St. Barnabas Soup Kitchen and running a team over there as we did the surveys. So the first page is really the federal questions that we ask for the survey. So it's things like, first initial, we try to keep it very confidential, so they don't have to give us all their information. They give us what they're comfortable with. There's some very invasive questions. Are you currently using drug or alcohol? Have you been incarcerated in the last 90 days? Do you have HIV/AIDS? Do you have mental health issues? Do you, those kind of things.
This is trying to get at the causes
Correct.
Of homelessness.
Of why they're homeless. So where will you sleep tonight? Those kind of things.
And then we ask data. You're not going to get any else.
Right. And then we ask a bunch of questions on the back of the form that are really local. Trying to ascertain what our local issues are. So, are you pregnant, or is anybody in your household pregnant? Have you gone to a soup kitchen or gotten a food box in the last 30 days? Are you getting food stamps or other types of assistance? Those kind of things that we'll use to identify where we're doing well with services or where we have gaps in services in our community, and help, to try to bring in funding to fill some of those gaps.
It was a packed room there at YCAP for the training, or the organization. Who headed that up at YCAP?
Well, we brought in Shauna Williams,
yes.
a former employee, contracted with her to come in and take the lead in organizing the stand down this year. She did a great job.
For the count.
For the count, yes.
And yeah, she was up organizing teams to be at all these different locations, and there were street teams, and I was on one of the street teams, and I just want to tell the story of we had heard there was a camp outside of town, out Highway 18, and 3 of us went out there and came upon a man in a tent with a fire, and did this process. And he had a bicycle; he could get into town, and it was quite an experience to shake hands with a man that's living in a tent with just a little few sticks burning in front of it. And he had his own story, very unique. I'm not going to go into it, but it was very unusual. He had a relative nearby, and it was just really something to get face to face with homelessness in our community. And I had a couple other experiences just going up to people and asking these questions, and then helping them. Part of the process is, like you said, is to ask those questions, what do you need? And here's what we can do for you. And there's dry socks to give them, and there's food to give them, and there's all these things that is kind of, we want to help too. So the homeless count, and we don't have the results.
No, that won't come in officially for another 3 to 4 weeks. We report them up to the state, and they're parsed there. And then, as Elise pointed out, we collect some data that we keep here that the state or the federal government doesn't necessarily collect, that helps us better serve our local residents.
All right. Now, another piece of this, so we address who's here and why and where they're coming from. Maybe the next step up the ladder is CWISH. Howie, tell us about CWISH.
Sure. CWISH is an organization of 6 different churches that all participate together through the winter months when the temperature drops 32 or below for a few days, or it rains for an inch of rain and it's 40 degrees, and we open a shelter. And each of those churches are First Baptist Church, First Presbyterian Church, Cooperative Ministries, True Vine Christian Fellowship, McMinnville Covenant, and Church on the Hill. And each of those churches open their doors for not more than 4 days. And they get their volunteers together, which have been trained to do this work. And each of those persons either do food, or they might do a 4-hour shift from 8 o'clock at night till midnight, from midnight to 4, from 4 to 8. And it's a rotation of churches, and we keep people safe. And so far this year, we've kept 481 shelterings in 4 events in these 6 churches.
So 4 events, 4 continuous days.
Well, 4 continuous events of weather.
Yeah.
The first event was 7 days.
Uh-huh.
The second event was 3 days. The third event was 3 days. And this last event that we just finished was 11 days in a row. So 4 out of the 6 churches participated in the 11-day one sequentially.
So community involvement, that's really grassroots community involvement.
It is really grassroots, and it's just a Band-Aid. It's to keep people from freezing to death or getting so waterlogged that they end up in the emergency wards and such. We really try to give them a place that's warm and dry, and a lot of compassionate people working to make all of that happen. Just to give you an idea of how involved the community's become, we had almost 500 Facebook shares on the 11-day event of people sending the information on to other people who shared it and shared it and shared it. So we all knew where the churches were, everyone in town knew where they were, and they could easily get there to be sheltered.
It's a great experience to be part of the team. So if somebody said, boy, I want to be involved in that, what would you say?
I would say that Thursday the 4th, which is tomorrow, we're having our final training session at First Baptist Church. And if anyone else wants to get involved in CWISH, we probably could make that happen as well. So.
Okay. All right. Well, there's another piece of the puzzle. Let's talk about, the next step up from shelter. Let's just stay with you for a minute, Howie. There's this perception that we can't really fix homelessness because the people don't aren't really looking for homes, or they're just doing that by choice. Can you talk a little bit about that?
I can. There's a number of people that are considered chronically homeless. And in that group, there's a small percentage that are what I call survivalists. That means that I prefer to live their own lives. They don't want shelter. They would just as soon stay in a tent, like you talked about. And then there's the ones that really do need the help. Really are seeking help, but they don't know quite where to find it. So,
Elise, you had a perspective on that continuum of people looking and not looking. You had tell us about
Well, I mean, I have never run across somebody, and I talk to homeless people a lot because I think it's very, very important to get their perspective on things. And I have never personally run across anyone when you actually talk to them at length that has wanted to be homeless. I mean, there's circumstances that have happened, things that have happened why they're homeless, but if they had a choice, they would be housed.
that. And Jeff, you had a couple conversations around that with some homeless people.
Well, yes, and just that they have certain ways that they prefer, they have chosen to live that don't meet society standards. Also, you certainly have a percentage of folks that are out on the streets right now that have mental illness issues, that have addiction issues, that have just come out of incarceration, and there are a lot of challenges with getting housing when you have some type of violent or sexual assault offense on your record, things like that. And so, those are hurdles that they face, and so they don't always, they're not able to get into housing, even the transitional or emergency shelters that we have, because of those things that they have with them. Some of them also have pets that they won't give up.
right.
And a lot of emergency and transitional shelters don't allow pets. And
So there's some barriers or some choices that make it so that they're not able to even get on that path.
Social anxiety is one of the biggest. It's really hard for them to be around other people.
Yeah, right.
And I'd like to just maybe quantify that somewhat. Maybe 20% are in that place where either there's barriers or they're saying, this is what I choose. The other, perhaps 80%, are people that say, look, I really want to get on the path to getting back into get a job, get clean and sober, be able to pay rent or buy a house.
Sure.
That's their path.
Sure.
So I just kind of want to address that idea that, well, we can't solve it because they're not looking. 80% approximately are looking, and those are people we can definitely offer that path to. The other 20%,
It's up to them.
and mental illness, addressing that issue,
Addiction of any kind.
social anxiety.
Yeah.
Yeah.
And Ken, can I just share one of my stories? So I was doing an account with a guy, and 41 years old. He had already had a stroke. He was driving after he had his stroke, had previous back issues, got into a car wreck, which exacerbated the back issues. So not only was he in chronic pain, but because of his stroke, he couldn't remember things. And so when I sat down to talk to him, he was living in the back of a car. So imagine having these chronic back issues. You're not seeing a doctor because you can't follow through on your appointments because you can't remember and nobody's holding your hand, right? So he had no advocate. Living in the back of a car with these chronic back issues. So what I did on site, which Jeff kind of alluded to and you kind of alluded to, was, when we do the count, it's not just counting people, it's trying to bring resources directly to them. And so we always have resource lists when we do the count at St. Barnabas, and we have housing applications and things like that. In his situation, no criminal background. So I started making calls on his behalf, called Gospel Rescue Mission, no beds available. I knew there was a new shelter in Newburgh, Helping Hands opened one for men. I called them and I said, do you have beds available? Yes. This is the situation. Would this person meet your criteria? We believe so. Okay, what's the process to get them in? Well, they need to be here between 5 and 8 tonight. And so I got somebody to take the guy there. Well, then the next day, my follow-up was calling Northwest Senior and Disability Services and saying, this guy's falling through the cracks. Can we get somebody to help be an advocate for him? He really needs Social Security disability. He needs to go to the doctor, all this stuff. And so then relaying that information to him and people on his behalf to get him to Northwest Senior and Disability Services from Newburgh to McMinnville during their open office hours to try to get him help. So, but I mean, it's not just, you know, they're not doing it because they can't or they won't. Sometimes they don't have the wherewithal. I mean, he couldn't remember if I gave him an appointment or a resource list and told him to go there. He wouldn't have been able to do it. Sometimes they just need somebody holding their hand and saying, okay, today we're doing this, tomorrow we're doing this. You know, he can be helped. We can help him.
And that's critical, what Elise is talking about, of having that ongoing intensive case management with a lot of the folks who have been out on the street, especially the chronic or even the short-term homeless, so they don't fall back off the ladder.
Where does that case management come from?
A lot of different organizations, and different organizations have different specialties. YCAP has case managers that try to connect folks with a wide range of services, some that we provide and some that other organizations provide. Other places have licensed clinical case managers who specialize in dealing with people with addiction issues or mental health issues. So it's as complex as the human being is. And it takes a lot of different organizations to be able to address this very complex issue.
Complex as a human being, and like I said when I met the man out in the tent, his story was absolutely nothing I expected. It was unique. It's hard to say, well, this is the problem, and we just need to do this. It's all different solutions. So this piece is a thing that we're talking about today. There's a lot of different pieces. So let's talk about another piece that's coming together. You know, who we don't have here at the table today, some people that are active. This is by no means an exhaustive list, but Heidi Lindell of Hope on the Hill, what they do there, and that nonprofit with feeding hungry and also part of CWISH, you mentioned that. Kate Sawyer, Gospel Rescue Mission. Right. I think I want to come back to that, talk about that. Then there's Kathy Neary at the Co-op Church with their everyday congregation, that they call it, addressing that. Let's go back to Gospel Rescue. This is something that's on the horizon. Something that exists now, and then there's this expansion that's on the horizon. Which of you want to kind of talk about what's going on there?
I'd be glad to do that. So they're taking out the old trailer house that is part of the 3 lots that they just purchased.
Okay.
They're taking out the old trailer house and bringing in a modular that was donated by the school district. Once they get that up and connected, and to meet standards of McMinnville and Oregon state requirements, then they will open that as a shelter at 45 degrees and below, continuously. So that will help a lot, because they will be able to take in 35 people per night in that modular and do that. They're also going to bring in a second modular after they tear down the old house next door and re-landscape, and that'll become the men's shelter. And then the house that they exist in today will become women and children only.
Okay, so I'm seeing another piece here, that going from temporary sheltering to transitional housing, I guess you might call that.
Yeah.
Then let's just stop for a minute and address something before we run out of time, and that is, so we have these pieces, we have these opportunities for homeless people here in McMinnville. I've heard a concern, if we build it, if we expand it, they will come, meaning homeless from all over the state, Salem, Portland, other states, and will be this magnet. We already have pretty good food services here, and we do have Gospel Rescue, and we do have people addressing this problem, probably in a very high level way compared to other cities. We're doing a good job. I want to say we're really working at it.
We're adequate.
We're adequate. Okay, thank you. So what about that, Howie? What about this thing of, well, if we expand our services, we're going to get overrun?
I don't think we're going to get overrun. That could be said of any township or city. If you look at Seattle, they just built a tiny house village. Eugene's been dealing with this for years and years, and they're at the forefront of the Oregon situation with homelessness, and it didn't attract any more people to their area than anywhere else.
And what about your experience with the people here that are without shelter, without homes? You know most of these people.
I fed them for a long time when I was
Yeah.
the operations manager at the soup kitchen.
Were people coming from Salem, or are they local folks?
They were basically local folks. Now, once in a while, somebody new would drop in. It might have been a family member of one of the other people, and they ended up on the streets because they couldn't get along, or social anxiety, or they had an addiction, or who knows what. But it's very few and far between that new people come in and stick around. Not everything is as jolly as it might seem, and even though we're the county seat and we provide more services than most of the county, it isn't the best place for them. A better place is Salem. I mean, there's more services there than here. You go to Eugene, there's more services there than even Salem. It's not any one city's area to say this is going to be the homeless central or homeless R Us.
Well, I wanted to address that concern. I think we've done it really well. Thank you. Let's move up. With transitional housing. Now there's more. Let's talk about YCAP. Has some shelters that are available. How
Yes,
does that fit into them?
when we were talking about the Gospel Rescue Mission, they provide emergency sheltering for a few nights, and that's critical and it's sorely lacking in Yamhill County. We provide that more transitional 1 to 6 months, let's say, of housing for folks who are getting established, finding a job, trying to collect some money to be able to put a down payment on a longer term apartment, working on their addiction or issues if they have them. So that's another level. And then you get into the low income housing next level of people who have more permanent but perhaps subsidized low income housing. And YCAP has 3 shelters, 2 in McMinnville, 1 in Newburgh, and then also a low-income apartment complex in Newburgh as well.
Let's go up the next step. I think that comes to you, Elise. How do you fit in? What's your piece?
So we do more of the longer-term housing subsidies and, subsidized housing types. And so a lot of ours is considered workforce housing where, families that are, even if they have 2 people working at minimum wage, they can't afford market rate. And so that's where the subsidies come in greatly. We have a large percentage of our clientele that's elderly, disabled on fixed incomes that would never be able to afford market rate units. And so we come in that way and do a little bit of a longer term. We also promote home ownership, low-income home ownership. So we help people. We have a self-sufficiency program. We set goals and move them through the process. And we have a lot of people that'll graduate and actually move on to home ownership, and that never thought they'd be able to do that just because they have kind of a hand that's helping them along, setting goals and moving them forward. So
We've looked at a continuum here, but one point you made earlier when we were talking was that there's not enough of any of it.
That's correct.
We showed some pieces in how they're fitting together, but
right.
Yeah, at the last point in time count, last year, we don't have the figures from this year's yet, but last year it was 900 in Yamhill County.
Mm-hmm.
So we can't begin to address that capacity in terms of any of the levels on the continuum, all the way up to just having affordable housing. And the other factor that's heartbreaking with respect to the homeless is 40% of them estimated are children. And so it's having them being impacted that along with their families.
affordable housing. There was a task force just convened. All 3 of you are on it.
Yes.
Yes.
Affordable Housing Task Force, McMinnville's Affordable Housing Task Force.
Correct.
And you're still looking at your charter. What's your purpose? You just convened and you're defining yourself. So that's another piece that the city has taken on.
Correct.
Let's go to preventing homelessness.
It happens every day. Just last week, a mill worker was laid off in Newburgh, and one of the facilities, Chehalem, what is it?
Youth and Family
Youth-
Services.
Got the word out, and some nonprofits threw in some money, and then individuals from all over the county kicked in $20 or this or that, and they were able to keep them from being evicted. Prevention is so important.
And it's a lot cheaper.
Right. If we can keep
cheaper.
someone
It is.
from losing their house by helping pay an energy bill or two,
Yeah.
helping paying rent for a few months to allow them to get by, start a new job, that makes all the difference in the world.
YCAP does that.
We do, and so do some other organizations. Yeah.
Let's talk about them. Give a little.
Yes, they provide short-term emergency
Short-term
payments.
emergency.
Right, the Community Compassion Fund at the co-op, we have ours, and we have other federally and state-funded programs that provide assistance.
And St. Vincent de Paul.
St. Vincent de Paul and Salvation Army.
Okay. All right, well, we just have a few minutes left. I would like to ask you, what's on your mind? What have you learned? What have you learned lately? What should people know? What have we missed? Just tell us what's in your heart.
I can go first. It is heartbreaking. I mean, if you've never helped with the homeless count, I would encourage everybody to do that. We've had people that have been in with the Housing Authority 15 years and they go out 1 year and help with the count, and they said, I had no idea. You know, and it's just heartbreaking. I mean, it's heartbreaking, but it keeps us motivated, I think, to do the things that we're doing, seeing the young people that are homeless and, you know, talking to them and just trying to find solutions. I think that's all what we're all here for.
Yeah, the young people that are homeless is especially heartbreaking. And YCAP also has a transitional living program for youth specifically, and emergency shelter for youth. And you know, trying to break that cycle that they get tied into is so critical. But we have seen progress, and there's hope for the youth and others.
Great. Howie.
I see it as just a community effort, not only in McMinnville, but across the county and across America and across the world. We are all coming together. We're waking up that these are our brothers and sisters, that we need to do something to help them move forward. We can do this work. We can all work together in collaboration and make it happen. There is no one specific simple solution to all of this. It takes a village, and it takes a lot of people on the street to do it. It takes a lot of people behind the scenes to do it, and I think that we're able to accomplish this. It's going to take a while.
One way of thinking about it with the homeless, it kind of makes it other, the homeless people. I've heard them called our neighbors without shelter.
Yep.
Our neighbors.
They are our neighbors without shelter. And we're all God's children.
And there's you know, opportunities to connect with them. There's this piecing community together that Howie and Elise have been instrumental in starting at the cooperative ministries that happens every month.
When?
Second Thursdays of every month
At the co-op, what time?
from 5 to 7 p.m.
Second Thursdays every month, 5 to 7 p.m. That's where people could get involved.
Fun and
Free meal.
And free meal. And sometimes a film, lots of artwork being done. We're going to have that artwork available to take out into community. The artwork is being done by the homeless themselves. They also have their street signs that they can make up. A lot of good things are coming out of this. A lot of people are becoming very aware and interacting with each other and community, and the community is becoming whole.
All right.
Anyone's
All right.
welcome. Yeah.
Everyone's welcome.
Thank you for being here today.
Thank you.
Thank
Thank
you.
you.
That's it for today, Local Matters. Thanks for watching.